Hello, everyone. My name is Kevin Riley, and I'm the editor of the Atlanta Journal-Constitution. To continually stay connected with you, we're back again with an exclusive virtual AJC Aging in Atlanta event featuring experts on several topics that matter most to you during these challenging times: COVID-19 precautions and testing, overall health and wellness, and money. And while this is a live broadcast, it will also be recorded and available on ajc.com/aging. We'll have each of our speakers introduce themselves, followed by conversations with each of them for about 8 or 10 minutes on their respective topics of expertise. Afterwards, we'll have time for them to answer some of your questions. So feel free to submit questions while watching this on YouTube or Facebook. You can use the comments or chat function on either, depending on which one you're using. Before we begin, I want to thank the sponsors who are graciously populating our panel of experts today: Kroger, Wellstar Health System, and Capital Investment Advisors. Here's a few words from our presenting sponsor, Kroger.
Kroger is a proud presenting sponsor of the Aging in Atlanta series, and Kroger is happy to announce that it has made shopping for the groceries and essential household items you need even easier by offering free pickup. Just shop online, choose a pickup time convenient for you, and Kroger will carefully pick out your order and bring it to your vehicle when you arrive. So the next time you're ready to shop at Kroger, take advantage of the free pickup. It's just another way that Kroger is fresh for everyone.
Okay, let's get started. Kimberly from Kroger, please introduce yourself.
Hello, my name is Kimberly Johnson, and I am a pharmacist with Kroger in Atlanta. This week, I'm helping with a Kroger Health mobile testing site in Columbia, South Carolina, and I'm here today to talk about COVID testing and staying up to date with your immunizations.
Thank you, Kimberly. Dr. Jeffrey Tharp, please tell us a little about yourself.
Hello, my name is Dr. Jeffrey Tharp, and I'm the Chief of the Primary Care and Medicine Service Line for Wellstar Health System. I also serve as our Chairman of our Quality Steering Committee. I've been a practicing internist in primary care for 28 years here, and it's a pleasure to be with you today. Thank you.
Good to have you here, Dr. Tharp. Dr. Patel.
Hi, I'm Chirag Patel. I've been with Wellstar for over 10 years. I'm a pulmonologist and sleep physician by trade, and now I work in population health and our quality and safety initiatives across the organization.
Thanks, Dr. Patel. And finally, our friend, Wes Moss.
Hi, everyone. I'm Wes Moss with Capital Investment Advisors and the host of WSB Money Matters on WSB Radio 95.5 in Atlanta, and a columnist for the AJC. And I've been doing that for getting close to a decade now. So I've been doing, it's a lot of weeks of columns, and I'm happy to be here. So thanks for having me.
Good to have you, Wes. Thanks, everybody. All right, we're going to start with Kimberly and ask her a few questions, and then we'll talk to our other panelists. So, Kimberly, here's a very direct question that I think is on a lot of people's minds now. What types of tests are there now for COVID-19, and which one should people get? I mean, how to decide?
Yeah, absolutely. So there are two kinds of tests available. They are considered viral tests and antibody tests. The viral test will tell you if you have an active infection. So a sample will be collected from your respiratory system, such as a swab inside of your nose or in your throat, and that will be tested to see if you currently have an infection with the SARS-CoV-2 or the virus that causes COVID-19. These tests are typically performed by a clinician at a testing site, and there are some newer tests available that allow you to collect a sample at home using a nasal swab or a saliva sample that you can send off to the lab. So the other test is the antibody test, and that is a blood test that tells you if you have had a previous infection. So these antibodies are proteins that help fight off infections and usually provide protection against getting that same disease again if you've been infected. So these proteins are produced after you've been infected. These antibody tests are not used to diagnose COVID-19 because it does take our body up to about 3 weeks for us to produce those antibodies after an infection. So you really have to determine how you're feeling and what your where you think you are in either current infection or you think you might have had it in the past and you want to see if you've had any of that immunity built up there. So one thing to mention is that the antibody tests are only being used to see if you have been previously infected. They're still really new, so we can't determine if you have immunity to the virus to prevent you from catching that infection again, or how long you can have that protection.
So Kimberly, where can people go to get these tests if they want to get one? And how much would they be prepared to pay? How much will it cost?
Yeah. So first I'll say if you think you're experiencing any symptoms, I definitely recommend contacting your doctor or your urgent care. That way they can assess those symptoms and order a viral test and start any treatment if necessary. They might also order other tests to rule out other respiratory illnesses like the flu. So the Georgia Department of Public Health now offers free viral testing for anyone who would like to be tested, regardless of symptoms. So last month, the AJC actually posted a pretty comprehensive list of testing sites in Georgia, and you can also go to the Department of Public Health website. They have an interactive map of all of the available testing locations. You can enter in your zip code to find the one nearest to you. And then the public health testing sites typically do not require an appointment. They usually just say you can drive up during their operational hours. Other sites are associated with clinics and pharmacies that would need you to register online and schedule an appointment. So those are usually connected with like Piedmont Urgent Care, CVS, Walgreens, and some independent pharmacies. And those testing sites should also be available at no cost to you.
So Kimberly, I go get a test. How long before I'll have my results when I do that?
Right. So it depends on which test you get. So some of the viral tests to check if you have an active infection are point of care tests. And so those can be completed and the results back almost within an hour. Other tests have to be sent to a laboratory to analyze. So you have to take into the shipping time, the 1 to 2 business days for the lab to process that. So sometimes that can be up to 5 days before you'll get your results there. I did see that the antibody tests, they are also processed by a lab, so it would be about 3 to 5 days for those two. And one thing I'll mention is that while you're waiting for your results, just be extra vigilant with your social distancing, hand hygiene, wearing a mask if you're going out in public, just until you know for sure what your results are.
Well, you mentioned social distancing, going out in public. So am I safe? I mean, are we safe going to the doctor or to our pharmacy to get tests, to get medicine, to get the things we need now? What's your advice there?
Right. So I know many pharmacies postponed vaccines for a while until we had a better understanding of the virus. But I would say it's safe to return to your doctor or your pharmacy for vaccines. A lot of patients were holding off on regular checkups with their doctor's offices, and that could lead to some consequences down the road. So I do recommend at least contacting your doctor's office, see what their procedure is for appointments now, but it would be safe to return to the pharmacy for vaccines. The vaccine area is always cleaned and disinfected regularly every day and in between any patients that are seen. And both the pharmacist and the patient are required to wear a mask during that interaction. I will say we do ask that you stay home if you think you have a fever, any respiratory symptoms, or other symptoms of COVID-19. And we don't want you to go out of your way to make a specific visit to your pharmacy just for a vaccine. We'd rather you kind of include it during a planned grocery trip or when you have prescriptions to pick up. Another thing, too, would be maybe calling ahead, maybe a day ahead of time, just to confirm that vaccine is in stock and to maybe start the paperwork to limit the time that you spend waiting in the pharmacy for your vaccine. The three main vaccines that I want to highlight right now, if you've got some time with me, are number one, the pneumonia vaccine. We've been hearing a lot of respiratory complications with COVID-19. And with the pneumonia vaccine, at least one dose is recommended for adults less than 65 if they have certain medical conditions. And it is recommended for all adults 65 and older as well. So you can check with your doctor or your pharmacist to see if you should get a pneumonia shot this year or if you've already completed that series. The second one I'll mention is the shingles vaccine. So I know at my pharmacy, we've had several patients who got the first dose of the shingles vaccine before the stay-at-home order, and it's still recommended to get that second dose within that 2 to 6 month window. So just think about when you received your first dose if you're one of those patients, and try to get that taken care of before that 6 month is up there. One thing with the shingles vaccine, so the known side effects with the shingles vaccine are possible flu-like symptoms. So that would include your low-grade fever, fatigue that could last just up to 24 hours. So just keep that in mind if you do have to go back for your second dose there. And then lastly, I highly, highly recommend getting the annual flu shot. So these are delivered to pharmacies typically by August, and the best time to get your flu shot would be in September or early October. So the flu affects millions of Americans every year, and the flu shot can really help minimize the toll of the seasonal flu on our healthcare system, especially since we've been talking about a possible second wave of COVID-19 coming around. So just keep that in mind.
Great advice and information, Kimberly. And thank you for that.
Yeah.
Also, thanks to Kroger. We'll be randomly drawing 2 winners of a $50 Kroger gift card from those who registered for the event today. You'll be notified after the program if you're a winner. Now, here's a message from Wellstar on their commitment to keeping you healthy and safe, especially during the COVID-19 epidemic.
The world has changed, but your desire to live your healthiest life has not. From temperature checks to extra deep cleaning, your health and safety when you visit our offices, health parks, and hospitals remains our top priority. Our primary care and specialty medical experts are ready to see you through any health concern you may have. We are here for Georgia, and we are here for you. Wellstar, more than healthcare, people care.
Now we're going to turn to you, Dr. Tharp, with some questions. And let me start with this one. What can older people do to keep themselves safe from infection, especially the states opening up, out and getting together, and people want to know, can they go see their family and friends?
Sure, it's a wonderful question, and it illustrates, I think, how we're all in this together. So for young and old alike, the number one thing is to wash our hands. That's the very first rule that we have, whether we're outside of our home or inside of our home. Hand sanitizer, of course, is a good surrogate. We've learned about social distancing in a hurry, really, after the pandemic hit, and we are understanding the value of wearing masks. And so wearing masks in accordance with the CDC guidelines is very, very important, and it will help decrease the transmission of the virus in our community. So whether you're at home or when you're out, hygiene is the number one thing. Social distancing is very important, and it's a very unusual concept to think about that we've never had to deal with before. And even through tragedies and stresses that we've been through our history, having to distance ourselves from other human beings is a foreign concept to us. And it requires a lot of cognizant, vigilant, and just being very, very diligent and being very, very careful. So we know that the risk of transmission of the virus increases when we're in contact with people who do not live in our home. So if we are going out, and we do encourage exercise, it's a great thing for young and old alike to do, but do it safely, do it smartly. do it where we can still have that social distancing. So walking in a park is a very nice thing if it's not a crowded park. And it can be a very good thing if you can continue your social distancing, as I said. But getting exercise is a very fundamental thing for both mental and physical health during the pandemic.
So what about symptoms? As we try to pay attention to staying healthy, and we get concerned that we may have picked up something, what to look for?
One of the things that we can all say, I think, is that we don't know everything about this virus. And so over the past several weeks, we've learned about new symptoms that may present. Classically, we're looking at fever, we're looking at shortness of breath, we're looking at pain in the chest, the unusual symptom of a loss of taste or smell. It's been described that the taste can even taste like black mold or sawdust or spoiled food. It's a very unusual symptom that we're not really used to hearing. But in older people,
Okay, let's talk about another aspect of this too. That is, I think, less often something people want to bring up, and that's the mental impact of the pandemic. I mean, so many of us are isolated. You talk to friends who haven't seen grandchildren in months, and it's just so hard, especially for elderly people who may even be more isolated and less ability to get around. What should older people do to make sure they stay healthy mentally?
Yeah, that's a wonderful question. And what we found is keeping in contact with family and friends is ever so important. We have the ability, of course, to FaceTime. We can talk on the telephone. I find it's very helpful in counseling some of my patients to relive old stories, look at photographs, tell the stories that went along with those. Lighting is very important, that we want a well-lit home, not only for mental health, but to prevent falls. Flowers in the home, for example, any kind of colorful item. And we do like to have people to have relaxation with their own hobbies. I think that's important that they maintain their own interests.
Now, how if someone starts to feel like, gosh, I'm just not right mentally, I need what? When should you call a doctor? I mean, when is it just a bad day, and when is it something more?
I think that one of the key things is observation of other family members. So what we see particularly in older people that may have any kind of trouble with cognitive issues, memory, is you'll see some behavior changes. And when you start seeing those, that would be a very, very important time to contact your physician. In everyone, however, when you find that there is such a decrease in your interest in ordinary things, sadness, classic depression symptoms, we would certainly want you to contact your physician or a mental health professional.
Now, as we talk about the health of people as they age, what are the most common health conditions that come up? I mean, what do people need to know about that when as we grow older, we're not just the same, but what's important to remember as we consider our health?
Absolutely. Well, one of the things that we look at and we are so concerned about during the pandemic and trying to emphasize, as Kimberly was saying earlier, that we have people come to the physician for their regular care, because things like heart disease, diabetes, undetected cancer, other chronic health conditions, COPD, our behavioral changes and mental changes we talked about earlier, all of those things happen regardless of the virus's presence or absence. And so to keep each individual healthy, we need to keep up with all of the regular health needs that they have. And those would be the things to look out. In addition, we are always concerned about injuries because of the propensity for older people to fall. It's important, as I said, to keep lighting and also to watch out for those obstacles around the home where people have been social distancing that could unfortunately be a trap and cause us to fall.
Now, I'm sure you know this, and I hope many in our audience do, but it's Men's Health Week. So let's talk about the biggest medical issues that men face. And are there conditions that men ought to be particularly paying attention to in themselves?
Absolutely. And I mentioned heart disease as being number one. And that's true for men. And what we've learned through our ability to do virtual visits, for example, from our physicians' offices, is that we can help people take care of their own health by checking their blood pressure at home. We certainly advocate for healthy lifestyles like smoking, limit alcohol, exercise that I mentioned earlier. Diabetes, we've also had a real renewed effort to have people check their blood sugars at home, and we can monitor those things at home. Certainly men, as everyone else is, we are subject to depression. And so the question that you asked earlier about mental health certainly applies to men. Injuries, talked about that earlier. We certainly want to make sure all of our men and women stay healthy and free of injuries.
Okay. Well, thank you, Dr. Tharp, for all of that good advice. And now we're going to go to your colleague, Dr. Patel. Dr. Patel, let's go back to the beginning of the COVID-19 pandemic, March of this year. We were hearing that older people and those with underlying medical conditions were more adversely affected by the coronavirus. Why is that? And is it still the case?
So, great question. We saw from the very beginning that folks who are 65 and older, people with chronic conditions, heart conditions, lung conditions, frail bones, history of rheumatoid arthritis, perhaps obesity, diabetes as well, fared much worse than people without those diseases. And there's a couple of reasons why we think that's the case. Number one, immune system is compromised in some of these conditions. Number two, the lung and heart is weaker in some of these conditions. And then lastly is sometimes we don't have these people having up-to-date flu vaccine, up-to-date pneumonia vaccine, and they have a higher propensity for illness. The other thing that we saw, particularly in this group of people, was if you happen to be obese, your chance of having a hospitalization was significantly higher, and chance of ending up in the ICU was even higher than that. So that is still the case. We're starting to see that in some of the states that are having an uptick in cases, particularly Texas, Florida, and North Carolina, Arkansas. And so we continue to monitor this very closely.
So we've heard the stories about people in nursing homes and senior care homes being adversely affected. If we have a friend or a family member in a place, a nursing home or one of those facilities, how can we help them stay safe and make sure they're safe? So
I think first thing, I think it's very important to stay connected to your family and your loved ones. And so how do we stay connected? We can do Skype, Zoom, FaceTime, the same way we're doing this particular meeting. I think social distancing, especially with your loved ones who are in a nursing home, is very important at this time. We are seeing across the country spikes in cases out of nursing homes. And the reason why that is in nursing homes, it is very difficult to socially distance. People are going back and forth from room to room. Older folks are socializing. They're used to doing their activities. And then also you have new residents coming into the nursing homes. And there are now strict procedures and policies and testing requirements to enter the nursing home as a resident. But prior to now, it was very challenging. And so you're starting to see that across the country as well. What I would say is most of the nursing homes across the country have implemented really good programs around testing and hygiene. And I hope to see these cases come down and people can start visiting their loved ones in person, hopefully soon.
Thank you. Now, one of the more confusing things out there is different advice about wearing masks and when and where and whether. What's your advice on that when it comes to masks?
Absolutely, it is something that helps. Are masks uncomfortable? Sure. Are they unsightly? Absolutely. However, it is the one thing that we know absolutely decreases the spread of the disease and your chance of catching the disease. 2 new studies out of Italy and China where wearing a mask actually decreased the rate of spread of over 60,000 cases in each particular country. So social distancing, absolutely important, but even more important is wearing a face covering, because a face covering gives you the liberty to move around. You can wear a face covering and go to the store more comfortably than saying, I'm going to socially distance and go to the store. And so when we think about re-entering society and re-entering, doing all the things that we love to do, particularly in the summer, face coverings are going to be that one tool that are going to help us do that safely. So
many people, doctor, are avoiding the doctor's office in hospitals. And for millions, it could be, they've lost their job, they've lost their insurance. How can people access medical insurance so they don't neglect their health?
Great question. So a lot of uncertainty due to economic consequences from the pandemic. We have seen unemployment rate high, 45 million people roughly with their jobs gone. And so how do we make sure people get the right care they deserve? Number one, you want to see if your employer offers a COBRA option, something that they can cover you for 90 days, 120 days. Often this is costly and is cost prohibitive, so that's not an option. Here's a second option. If you have a spouse or significant other, see if they have an employer-sponsored program who has loosened the enrollment guidelines due to the pandemic, and maybe you can jump onto an employer-based program of a spouse. At the minimum, ask if you have children, to get on your spouse's coverage, at the minimum. And then number three, see if you're a candidate for Medicare. Medicare has a lot of options, and that may be an option if you're in that 65 and older range. Also, underinsured or uninsured at a certain income level, Medicaid could be an option as well. Now, if you're not a candidate for any one of those, one excellent option is the Affordable Care Act did bring some new products to the state of Georgia. These exchange products, we have a lot of experience with them at Wellstar. They give strong coverage for a variety of number of folks. It is easy to get, and it is something that is readily available for all individuals. And so really it's a matter of taking the energy and enthusiasm to go find these options so you can continue your healthcare in an appropriate fashion.
There are also a lot of people who are postponing medical visits and procedures, avoiding the emergency room because they're worried about getting COVID. What impact is that having, and is that concern warranted?
So I completely empathize and sympathize with those concerns, and I think it's very easy to feel this way. You see a lot of sensationalized news on the television. What I would say is Wellstar in particular has taken the appropriate policies and procedures to ensure the safety of their patients first, and then also of their team members. I feel 100% confident and comfortable to recommend even my parents to come to the hospital or emergency room at any time now. There's all the appropriate things have been put in place. And let's talk about those things, right? There's frequent hand washing, there's face covering, there's eye shields, there's hand sanitizers everywhere. We turn rooms over with a specialized cleaning process. The ORs have a new process to turn the rooms over. And if you really look, what is the cleanest place in the United States? The hospital. And so you can assure that you're going to be taken care of if you go to the hospital in an appropriate fashion.
Thanks so much, Dr. Patel, for those insights and that advice. And now, a message from Wes Moss and Capital Investment Advisors.
At Capital Investment Advisors, our mission statement is to help families find happiness in retirement. We do that by building customized income portfolios that provide a steady income so our families can focus on their core pursuits and being happy retirees.
Wes, good to see you again. And so let's get right into the questions.
Thanks for having me back.
Yeah, so much concern about what's going on in the economy. So let me give you something really specific to respond to. Imagine I'm 65 and recently retired. My well-diversified portfolio has taken a hit during this market, during the COVID-19 concerns. In many ways, it feels worse than anything I've ever seen. Should I just sell out, get my money, and hold on to the cash until we recover? What do you think?
Well, I think it certainly feels that way. I think that's the natural reaction for any investor. You go through an unprecedented time that is arguably the worst. Not only do we have a health crisis, but really an economic crisis. Dr. Patel just mentioned we had to the point we have 43 million people have lost their job. Now we have about 21 million people that are currently unemployed. So some of those folks have been hired back. But it does feel for a lot of folks that, particularly as you hear about, well, we're going to have a second wave. Well, what does that say? It says the images of overrun hospitals and economic shutdowns and lockdowns, I think are still so fresh and still so scary. I think it's kind of the natural reaction to say, maybe I should just wait this thing out. But the reality is that when it comes to investing, the market is very forward-looking and typically bottoms, and I've talked a lot about this through this crisis in March and April and May. The market bottoms about 107 days on average before a recession ends. So the market anticipates when economically things are going to get better. It doesn't wait for the economy to get better and then start higher. And interestingly, as terrible as the last couple of months have been economically, and really a whole brand new set of issues that we're having to deal with economically. We've never had to deal with lockdowns before. Interestingly, if you look at the data, the market actually did exactly what it is supposed to do historically. It turned higher about 100 days before, or a couple months before we got out of recession, which is very interesting. You know, we're very likely out of recession. Now, it doesn't mean we're back to where we were economically, but the market in the depths of March 23rd went down it went down February, it went down March precipitously, down 35%. It started to rally at the end of March, and then into April, and then into May, and actually done okay here in June. So it rallied a while before we've just started to get numbers for May, and we saw that we added 2.5 million jobs net for the month of May. That doesn't mean we added back we still have 20 million unemployed, but we are now moving economically in the right direction. We just had retail sales numbers come out, which is a really important number to look at how we're doing economically. And it shows that we're back to, and we're spending a little differently than we were a year ago, but we're back to 94% of the spending we were last May, which is amazing that we would be that back that much as an economy. So the market has rebounded in a lot of ways. And if we think that we get a vaccination or a vaccine, we get a therapy over the next 6 to even 8 months from now, and I know there's talk about a September, October, that's a possibility, we don't know for sure, then you're going to see an economy that may heal very much towards the end of 2021, literally back to normal, whatever normal is. And I think we're headed there. And if you wait it out until things are good in the economy, then it's going to just be too late in markets. So you really have to be able to be forward looking and know and remember. We all have to remember that investing is not for the month we're investing or even the 6 months, but it's for the next several years. And quite frankly, that's the only way you really can be an investor long term, is to have a long-term horizon that, hey, as this economy gets better, the market will repair itself, and so will a portfolio.
Okay. All right. So, there's been so much talk about government help, and of course we saw the first wave of that. What do you think about that? Do you think the government's going to do more? And if it does, what are you hoping the government does?
Well, the government has done so much lately. They to some extent, governments, now these are more local, have kind of asked and forced these shutdowns. But then on the other side, so they've purposely, and we as citizens have been in agreement for the most part of this, particularly in March and April, of saying, hey, we get it. We don't know how bad COVID is, so we're okay to all stay home. But at the same time, we also had unprecedented fiscal stimulus, $2.5 trillion through the CARES Act, enhanced unemployment, loans for small business owners, really just a remarkable amount. $2.5 trillion is a hard amount to even conceive for humans. And then on the monetary side, the Federal Reserve has stepped in with at least $3 trillion worth of purchases of assets, particularly the bond market, the fixed income market, to shore up the whole financial system. So the response to the unprecedented lockdowns has been unprecedented stimulus or relief to kind of patch the hole that government almost had to kind of mandate to get us through this to some extent, create hospital capacity, and then really learn a little bit more about how we will fight COVID-19 economically moving forward. And I don't know that there was talk this week of another $1 trillion stimulus bill for infrastructure. I think you'll probably get one. Remember, it's an election year. Election's coming up relatively soon, so I think that there is a propensity to want to do more stimulus and get the economy up and running. So I think that I don't know if we necessarily need the stimulus. I think what we need to do, and I think that this is a harder task, is to understand, and I could be certainly wrong about this, that the broad lockdowns that just shut the economy down and made the stock market go down almost 40% in a really short period of time. Those broad lockdowns are very, very unlikely in the United States again. There's not, the political will is not there to do it. Quite frankly, my wife won't do it. And if she was on board for lockdowns for a while, but you have a couple kids. We have 4 little kids at the house. My wife will not allow a lockdown. The Americans need to be up and out in the world. We just need to do it safely, like both Dr. Tharp and Patel just talked about. We need to be able to get back to the world we live in and do it in a safe way, and I think we'll do that. So I don't think we need a ton of stimulus. I think we just need to keep the economies back open.
Well, why don't you keep going down that track, Wes? I mean, how do you think Georgians are handling the reopening of the economy, and what's it telling you about what's really going on economically?
Yeah, there's a lot of ways to track this data. Certainly, the economic numbers you get from, let's say, the Bureau of Labor Statistics and the Commerce Board, that tells us national numbers, and it's to some extent backwards looking. You can look at I track restaurant data, and you can see that fast food, by the way, is almost back to full capacity in the state of Georgia. That the casual dining, where you go to actually sit down. I think there's been a great comeback of pavilions, by the way. The pavilions, outside pavilions and fans have made a great comeback in 2020 because the restaurants took a little while to reopen, even though they were allowed to all the way back in the end of April. Most didn't. Most took a while to figure out, how do we do this? How do we do this dance? And I can tell you that commerce in this state is very much back up and running. Except for the airport. Now, I'll talk about, and that is the next, I think, difficult part of the economy, is that you're going to see a Delta, and AJC has written about it. I just wrote about it in the AJC that's coming up this Sunday, but it's widely reported that Delta is going to probably not lay off. They're offering early retirement packages to 30,000 people. And that's Atlanta. That's a Georgia company for the most part. So there's still a long way to go. We're still not out of the woods economically. Now, I do track the TSA data, TSA screening data, which you can look at. We a normal day through the airports of America is about 2.5 million folks. We got to the point where we were less than 100,000 per day. 2.5 million to 90,000. And that lasted for almost all of April. We got back to 200,000. When I wrote my AJC article, the notes, I think it was 300,000, and I just submitted it yesterday and revised the number to 500,000.
Hey, Wes, I'm a little concerned that you're, pushing your deadlines too far in those AJC columns. We got a paper, it's got to print, it's got to be delivered on time. So let's watch yourself there, okay?
I'm very cognizant of that, but the data changes so quickly. It's amazing. So if you could ask my editor, Liz Manette, to give me some extra time, I need it. But listen, I think Georgia, we were under the microscope. Germany and Georgia, the country of Germany opened about a week before us, and then we opened up first in America. And I don't think we've ever been under more scrutiny. And quite frankly, I think a lot of folks there's a lot of rooting even against Georgia. Like, you're doing this too quickly, you're gonna fail. And I don't think we have. I think the economy's done a really good job. I think obviously if you look at the numbers, COVID cases have trended back higher. Hospitalizations in general are still much lower than where they were back in April. So I think it's just we're not in the clear, but I think we're at least it's shown me all the way through the month of May, and now halfway through June, we've been able to be relatively reopened without flooding the hospitals. And I'm optimistic at least that we can keep doing that. So I think Georgia's done a really good job.
Okay, thanks, Wes. So now we're going to move to my favorite part of the program for two reasons. We're going to take some questions from our audience that they've submitted, and they'll come your way, each of the panelists. And if this works the way we hope it will, we'll hear the voice of the AJC's Pam Richards, one of my favorite people at the newspaper who I haven't seen in a long time. So it'll be great to hear your voice, Pam. So Pam, let's have some questions.
Thank you very much, Kevin. I've missed seeing you as well. All right, let's start with Dr. Patel. Our first question is for you. Are we in a second wave of COVID now? And if not, what can we do to avoid going into one?
Oh, fantastic question. So we're still in our first wave, if you want to call it. It's just an ongoing of the first wave. For it to be a decrease of the first wave, we would have to have seen a steady decline day over day for a long period of time. And even though, as the previous speaker said, we're stabling off, we're doing better, I wouldn't necessarily say we're out of the first wave. So you can't necessarily enter a second wave until you're out of the first wave. But there's a lot of things that we can absolutely do to prevent a second wave from coming and exiting the first wave. As Dr. Tharp mentioned, we want to wear our face masks and our face covers. We want to get our preventative screenings and our vaccines as we can possibly do as fast as possible. And then ultimately, you want to use those social distancing guidelines and frameworks in how you go about and reenter society. Smaller groups, bigger spaces, try to be outdoors, just thinking through where you're going, why you're going, and does it fulfill a social distancing requirement?
Excellent. And that actually kind of loops us into another question that we have for you, Dr. Patel. And this is one that kind of touches my heart too. Is it safe for me to hug my 76-year-old parents?
So that's a great question. I firmly believe in human contact and staying emotionally, spiritually, and physically connected to your loved ones. So let me just put that out there. However, this is about protecting our family members before meeting our own emotional needs. And if you haven't been in a social bubble, if you will, with your family member, you probably need to give them an elbow bump and say, "I love you, Grandma." I think that's really more appropriate because this is about protecting them more so than protecting yourself. And so my inclination, elbow bump, a straight look in the eye, and "I love you" is probably more appropriate if you haven't been in that social bubble with them. It pains me to say it.
Well, I'd rather do that now than have to deal with the consequences. So thank you for that advice, Dr. Patel. Dr. Tharp, we do have a question for you. Are all your offices open, and is Wellstar now doing surgical procedures that were postponed early in the COVID situation?
Yes, and I want to compliment our surgical services, both at Wellstar and Metro-wide throughout Atlanta, that had collaborative discussions about when the timing was going to be right to reopen surgery. I'm an internist, so I'm a little bit on the sidelines, but I have a whole lot of respect for the process that went into that. And our Chief Surgical Officer, Dr. Bill Mayfield, was one of the leaders in that Metro-wide effort. And really looking at the concept of what we call time-sensitive surgeries. We used a concept of elective surgery, thinking it might be able to be put off. And there still are some surgeries that are truly elective, not just cosmetic, but some other things. But in the meantime, when you look at the time of delay of certain surgeries, that would also increase morbidity and mortality for folks who had these underlying conditions. So we've really looked at prioritizing the reopening of our surgical services to what we call time-sensitive surgeries that needed to be done sooner rather than later, but were not being done during the height of the activity in April.
Excellent. Thank you very much. While I still have you, can you talk to us a little bit about why obesity is such a factor in a more severe COVID case? We've had a couple of questions about that.
Yeah, and the first two physiologic concepts I would like to emphasize are comorbidities. So people who have obesity tend to have more problems with high blood pressure and diabetes, for example. And then there's been a recently released study that was showing about the oxygenation that it gets into the periphery of the body. And so the oxygen has to be there to help the body fight infection and to heal. So when we look at the triple whammy, if you will, of diabetes, heart disease, and blood pressure, and peripheral oxygenation, those are three of the leading concepts that we are using right now to explain the answer to the question. But like I said earlier, we don't know everything about this virus yet. So we're learning more every day.
All right, thank you very much. So Kimberly, we do have a question for you. You talked about the tests that we can take for COVID-19. How long do the results for the test last? Do you have to get retested? And we may want to pull in one of the doctors on this one as well.
Okay, no, that is a really good question. I believe the answer to that would be dependent on which test you originally received. So if you did have a viral test where you were looking for a current infection and you tested positive for that, there are some workplaces, I believe, that have a policy where they do want you to test negative before you can return to work. Other policies would include, being fever-free for 72 hours without any medication, not having any of those typical symptoms of an active infection. So it would really depend on your workplace in that scenario. I think if you test positive and you're not currently working, or you have other things going on, it's not necessary to get that second test to confirm if that active infection is gone. Concerning the antibody test, since that is only verifying if you've had a previous infection, at this time there's just not a lot of information about that. They're doing a lot of studies, again, to see if that antibody positive result allows you to have immunity against the coronavirus, and also for how long that immunity would last. So there's just not enough information about that one yet.
All right, thank you very much. Okay, Wes, have you got any tips for preparing to handle the high cost associated with assisted living?
So the assisted living costs have continued to go higher and higher, and it's a really difficult scenario for families to have to go through. And I see a lot of folks, let's say that with their parents that are going through that, So you may be in your 50s or 60s and you're trying to retire, and then you got your parents in their 80s or 90s, and you're trying to figure out how to help them pay for assisted living. I think that what we've been able to do over a lot of years is try to make sure that someone, when they're doing their planning, let's say in your 60s and your 70s, try to plan on multiple streams of income to be able to continue to pay for assisted living in the future. Now, that can come from a lot of areas, obviously. Social Security for not one spouse necessarily, but two potentially, a pension for one or two, and then assets that can then produce some sort of income on top of that can pay for an assisted living. And obviously, there's certainly different levels of assisted living. The reality here is that not everybody can do that. And then you get to the point where you have an assisted living facility that's $5,000 a month or $8,000 a month, and you just can't afford it. And that's where there's really no easy or good answer to that, except for trying to potentially have it be almost a family responsibility. So if you have mom and dad, or just mom or just dad that goes into assisted living, and there's 2 siblings or 3 siblings or 4 siblings, then I see that's a scenario where family members have to sometimes step up, contribute collectively to be able to get mom and dad into a place that they're comfortable with. So those are the thoughts about that. There's certainly the thought of long-term care, which obviously is more for medical. So long-term care insurance is another answer, at least on the medical side. Problem with long-term care is that it's so expensive to buy. So most people that I run into that are able to afford long-term care insurance for healthcare purposes probably don't need to buy it because their assets are going to be able to pay for them in the future anyway. So I think that it is very much about, just like retirement planning takes multiple years. It takes 20, 30, 40 years. Being able to pay for assisted living is part of that retirement planning. It's just the latter phase of retirement planning. And it's something that really needs to be built in and planned for early on, if humanly possible. If not, and you can't afford it, then the family has to step in and support each other.
Thank you very much, Wes. All right, Dr. Tharp, you talked a little bit about depression earlier. How can you recognize depression in yourself if you're a senior and you're living at home, or you're living alone, or you're living with a partner and the partner constantly says, "I'm fine," but you know they're not?
Well, there are 2 parts to the question. Obviously, with someone living alone, if someone gets to the point of having those concerns, they need to contact their health professional immediately. Because, as you said, there's often a delay in recognizing some symptoms in ourselves. There's some internet resources and a lot of literature around that can go through self-check questions that people can ask. The other issue is if another family member has the concern, but the patient denies it, then that becomes a little bit trickier. And I would encourage that the concerned part of the family actually make the contact with a health professional. And that way, there's a little bit more background when the patient comes to see the physician that the patient may not want to disclose. People do send letters. They write letters and they send emails and they communicate with the electronic chart. So I think it's very, very important to keep that loop of communication in check, because if not, then the symptoms could escalate and lead to worsening disease.
Got it. Thank you very much. Dr. Tharp, are gyms safe to go to now?
You know, it depends. And if you look and see the social distancing guidelines that were outlined when the state began to reopen, we have very, very clear recommendations on how things should be clean, how far apart people should be. We do believe in exercise. I think that those were the guidelines. And really, if you really go to the heart of it, where do you feel comfortable? So when you see a place that looks clean or a place that looks dirty, you're asking yourselves these questions. But if you see an X on the floor where there's been social distancing, there is a visual from the gym staff that equipment has been cleaned, then I think you could feel a lot better about going to that kind of place.
Great, thank you. And I think we've got time for one more question. And this would be for Dr. Patel. So I'm 70 years old with no symptoms of COVID. Should I ask my doctor to be tested?
So there's two schools of thought. One, you don't need a test because you don't have symptoms. And then two, it's the curiosity of knowing if you've been exposed and had the disease in a very light manner and want to know. What I would say is not to put yourself in additional risk to get a test unnecessarily, because then you don't know what to necessarily do with that result. And so if you develop symptoms, go get a test. When the antibody test is available and it's appropriate to have an antibody test, when we know what it actually means, you go and have an antibody test. The other issue with the COVID test, there's what we call a false positive and a false negative. And that rate is anywhere from 15 to 30% depending on the brand of the test. That means you go get tested, it's positive, but really it's negative in 15 to 30% of the time, and vice versa. So it's really difficult to know what that actually means. Really, when the strength of the test is this, you have symptoms, you go get tested in that time period, and your test comes back positive. Positive tests with those other two things tells us more than anything else when those three pieces of information are put together. If you have any one of those three pieces of information in isolation, doesn't mean anything. If you have symptoms of cough and congestion, could be flu or a viral syndrome or something, you have a positive test by itself, doesn't mean anything. Could have been whenever, or it could have been negative by false negative. So you really want to take all three items, put them together to make a decision. And so if you're just wanting to go get the test, I would advise you probably not to do that.
Okay, thank you very much. And Kevin, I'm going to throw it back to you because we do have a few more questions, but we're running out of time.
Thanks, Pam. Always good to hear from you. And thanks, everyone, for those questions. What we're going to do now is I want to give our panelists a chance to share one final thought with the audience. And I'm going to start with you, Kimberly.
All right. So one final thought. So I'm just very glad that we're getting a better understanding of what this virus is doing. And we've seen a lot of positive changes in our healthcare systems and our pharmacies on how we are reacting to that and providing, that social distancing, the lines on the floor, and just extra hygiene, hand washing to make sure we're not causing any additional infections or spread. So I'm just happy with the change that I've seen in my workplace.
Thanks, Kimberly. Dr. Tharp, your final thought.
Yes, I want to emphasize the thing that we started off talking about, and that is washing hands. It is so simple and yet so effective in preventing transmission of disease. I'm very, very happy to say that we are learning as much as we can about this virus as we go along, but again, we don't know everything. I would encourage folks to check out reputable sources about any new guidelines about Mayo Clinic Network, and they have great resources. And do not ignore your ordinary health needs. Contact your physician.
Thank you. Thank you, Dr. Tharp. How about you, Dr. Patel?
I want to first start by saying thank you so much for having us on. I think addressing this COVID pandemic is a team sport. You got to do it as a team. And the one thing we can do as a team is encourage each other to wear face masks and face covering without stigma and pointing fingers, because that is the one thing we know, in addition to hand sanitization, that reduces the virus.
Thank you. Thank you, Dr. Patel. And Wes?
I'm just trying to think of some final thoughts here, Kevin.
You only are allowed to have one final thought, Wes.
Just,
so if that makes
let me just have multiple thoughts wrapped up into one final thought.
Okay.
Is that I would just say to our audience is be careful of the news, like particularly cable news channels. It's impossible to find an unbiased television station in America, and it's really easy to scare people. It's a much easier. Okay, take it from me, being in the media for now, I don't know, 15 years. It's a lot easier to do a scary show than an optimistic show. So that's one thing. The second thought is that although we are really in an and by the way, the AJC is not part of what I'm telling you not to participate in. By the way, number two, although this is an unprecedented problem, and it's a maybe a larger mountain to climb for this nation than we've seen in let's say in a generation, we've also had an unprecedented response. So whether it's a government response, a fiscal monetary, the response of all of us together, and then our medical community is also unprecedented. I mean, we've never spent so much money to try to tackle an enemy like we're doing right now. And then just the last thought is that, listen, this economy will rebound. It's going to rebound. It's not going to rebound tomorrow, but this time next year, I think it'll be a very different picture and a better picture. And that just remember, for the investors out there, is that just remember that often the very most rewarded virtue in investing is simply patience. And I would just remind us all that.
Thank you, as always. In closing, we want to once again thank the sponsors who made today's program possible: Kroger, Wellstar Health System, and Capital Investment Advisors. We'd also like to recognize those sponsors through the year who support the AJC's Aging in Atlanta series. And be sure to visit ajc.com/aging for updates on the topics we hear from you matter the most, as well as the recorded broadcast of today's event. Thank you so much for joining us. And we're looking forward to picking up the AJC Aging in Atlanta series again this fall. So if we can't see you soon in person, we'll see you right here in an Aging in Atlanta broadcast. Thanks, everybody.